Bismillahirrahmanirrahim. Today we are going to discuss the different insulin regimen used in patients with diabetes in pregnancy. Before that, I made another video about the diet regime for the patient with diabetes in pregnancy, but different people demanded that there should be a video on insulin regimen as well. So I have made this video specially for you for your exam, especially for FCPS Part 2 long cases exam. Okay. So let us discuss the different regime. Now the question rises, how many regimens of insulin do we have for diabetes in pregnancy? Answer is that we have many regimes available, but we should use the one which suits our patient and our clinical setup. Okay, so first of all, the first regimen that I'm going to discuss with you is called the Basal Bolus regimen. Okay, this regimen is used specially for the GDM patient, for those who have diabetes in pregnancy, those who does not have diabetes before pregnancy, those who are not already known diabetic. Okay, so for the GDM patient, first of all, we need to measure the weight of the patient. After measuring the weight of the patient, we will divide the weight by the 2. Okay, let us have an example. For example, the patient weight is 56 kg and 56 by 2 is equal to 28. Okay, so now we divide it further by 4. Okay, so 3/4 will be the dose of Humulin R or short acting insulin, which will be the basal dose, and 1/4 will be the dose of Nph or intermediate acting insulin, basal dose at the night time. Okay, for example, the weight we calculated was 28. So 28 divided by 4 is equal to 7. So the dosing will be 7 units short acting insulin 3 times with each meal, and 7 units Nph insulin at night 1 time at the bedtime. Okay, now coming to the insulin, Nph insulin and Humulin R insulin, means some examples of those, as we have discussed in these regimens that we will use the Nph insulin and Humulin R insulin. So let us have some example of this. Nph insulin is basically the short acting insulin. Another example of it is Humulin, and the onset of action is 2 to 6 hours and the duration is 18 hours. The Humulin R is short-acting insulin, and other example of it is Actropid. Onset of action is 30 minutes and duration of action is 4 to 8 hours. Now coming to the regimen 2. Okay, for those patients who are non-diabetic, who have diabetes even before pregnancy, in them we will use the trimester-wise dosing. Okay, or the dosing according to the gestational age. For example, if a patient is having gestational age of 6 to 18 weeks, then we have to prescribe 0.7 units per kg body weight insulin per day. If gestation age is 18 to 26 weeks, then 0.8 units per kg body weight insulin per day. If 26 to 36 weeks, then 0.9 units per kg body weight insulin per day. If she is at 36 to 40 weeks, then we have to prescribe 1 units per kg body weight insulin per day. What type of insulin do we use in this dosing according to gestation age regimen? We use first of all the long-acting insulin before the breakfast and dinner, and the short-acting insulin is given before each meals. Now, what are the examples of long-acting insulin? The example of the long-acting insulin include the Glargine, Lantus, Datimer, Lavemir. Onset of action is 1 to 2 hours and duration is 24 hours. Okay, so these are the 2 regimens, and we calculated the dose according to the specific formulas, and we prescribe the insulin according to these regimens. Okay, and but sometimes what happens that the patient cannot maintain the insulin the sugar level according to these insulins which we have prescribed. In that cases, we have to review the diet chart of the patient. Okay, and if the diet chart is appropriate, then we have to increase or decrease a little bit the amount of dosing which we have fixed already. Now coming to the regimen 3, which is called the biphasic regimen. In biphasic regimen, it's the type of regimen which is not usually preferred. Calculate the dose of the insulin, okay, which is in fact 1.1 unit per kg body weight. Means we have to multiply kg by 1.1, and it's very important that we should not exceed 60 units of insulin per day, and the total daily dose is then divided in half. Okay, and the mixed start insulin is used as combination of NPH and regular insulin. Okay, we said that we divide the dose into two halves, okay, into two parts. So the morning dose before breakfast will be the total dose which we have calculated by multiplying the kg in weight in kg by 1.1. That total dose, we what we do with that, we divide into two parts, and 2/3 of NPH is given in the morning, okay, and 1/3 of regular insulin is given in the morning, and in the evening we give half of the NPH and half of the humulin oil. But there are certain important things to be remembered in this regimen. Is that those are obese patients require additional doses of NPH at night time, and the main side effect is that of the hypoglycemia. Okay, and this regimen is not usually preferred due to side effects, and it is planned in collaboration with the diabetologist. Okay, so these are certain important regimens which we commonly use, and in exam the questions might be asked related to that. Thank you so much for your patience. Allah Hafiz.